A very good afternoon to all my dear students. I welcome you all into the Industrial Pharmacy first. Dear student, we are studying the Industrial Pharmacy first. And while studying the Industrial Pharmacy first, we have to go through the study of different kinds of the dosage forms. Now, among all the different dosage forms, broadly these are classified as solid, semi-solid, and the liquid dosage forms. Among the liquid dosage forms, in our previous lecture, we had covered the details associated with elixir, syrup, suspension, and emulsion. As far as the solid dosage form is concerned, we had covered the details associated with the tablets and all the aspects associated with tablet manufacturing, its types, advantages, disadvantages, then granulation, the methods of preparation, then compression, etc. etc. Now, in the series of solid dosage form, today we will going to discuss one another dosage form which is very commonly and popularly called as capsules. Now, what this capsule is, what are their details, that we will going to come to know through next couple of slides. Again, it is very difficult to cover the details associated with the capsule in just one lecture. We require several number of lectures, some 4 to 5 like that. So we will try to cover all the aspects associated with the capsules during those lectures. So now let's beginning with the capsule. So our lesson plan and the learning outcome. That means once we will go through the details, after going through the details, what the student that should come to know or what is expected that the student should come to know after going through the lecture. So that is the learning outcome. So learning outcomes for the capsule is the what the capsule dosage form is, what will be the advantages and disadvantages of the capsule dosage forms, what is the composition production of the capsule shells, how these are going to be produced, how the capsules are going to be sorted, how they are going to be printed, and how they are to be stored as far as the empty capsules are concerned. Then we have to go for the hard gelatin capsules. That means the total details that will consist of the two different parts. That is the shell, its details, its manufacturing, and after forming the shell, there is a need to load the material into the shell. So that is the formation of the capsule. So based on the type of material, based on the type of shell, there are two different types of capsules which are said to be the hard gelatin capsule and the soft gelatin capsules. Now, what is the difference between hard gelatin capsule and soft gelatin capsule? We will going to know. We will go through the details associated with them. So, while studying, while learning the capsule, our lesson plan that will move through the definition, some of the basic concepts associated with the capsule dosage forms, the advantages and disadvantages of the capsules, the capsule shell production, then storage of the capsule shell, and the hard gelatin capsules. So let's begin with the definition or how we can explain the capsule, isn't it? So what the capsule is, already I told you that capsules, these are the dosage form. Which kind of dosage form? It is the solid dosage form. Now, in case of capsule, the drug substance that is going to be enclosed. So, capsule are the solid dosage form in which the drug substance that is enclosed within either a hard or soft soluble shell. The shell that will be solubilized inside of our body. And usually, this entrapment of a drug substance, that process is carried out with the help of a material that is the gelatin. And the term capsule, that is derived from the Latin term. So what is the Latin term? Latin term is the capsula. Capsula, that is nothing but the small container or a small box, right? So that's why how the capsule term that had originated and that came into existence. So as far as the definition by British Pharmacopoeia is concerned, capsules, these are the solid preparations with hard or soft shells of various shapes and capacities, usually containing a single dose of active substances. They are intended for oral administration. So as we saw for the tablet dosage form, tablet is the unit solid dosage form. In the same way, capsules are also the solid dosage form, and no doubt these are also the unit dosage form. So these are unit dosage form, solid and liquid material, they both can be used in case of the entrapment of the capsule, and these are meant for the oral route. So there are few capsules which are to be taken by other than that of the oral route, like say the vaginal or the rectal route. But prominently, if you see, these are to be taken by the oral route. And the first capsule that was developed in 1834 by a Persian pharmacist. So if you see the market share as far as the capsules are concerned, worldwide approximately if we see, there is a 20% share of the market in which the drugs that are prescribed in the form of the capsules. So what we can supply or what the material we can fill inside of the capsule. So you can see there are a number of materials that can be filled inside of the capsule. So we can go for filling the dry powders in case of the capsule. We can go for filling the semi-solids in case of the capsule. We can go for filling the non-aqueous substances. We can go for filling the beads. We can go for filling the tablets, mini tablets, and some of the capsule inside of a capsule. Let us say the two different capsules. If there is an incompatibility between the content, then in that case, a small capsule is to be loaded inside of the larger capsule, where the outer shell that will get degraded first of all, releasing its content, and then it will going to be releasing the inside capsule. So we can go for supplying, we can go for filling dry powder, semi-solids, non-aqueous liquids, beads, mini tablets, and the mini capsules through the capsules dosage form. If you see the types of capsules based on the type of gelatin material which is to be used, there are two different types of capsules which are said to be the hard gelatin capsule and the soft gelatin capsule. So hard gelatin capsule, no doubt the gelatin material that is tough, that is hard, and in case of soft gelatin capsule, the gelatinous covering that is soft in nature. There is another capsule which do not use the gelatin material for the shell purpose, for encapsulation purpose. So these are said to be the non-gelatinous capsules, and the example is the hypromellose. Acromellose, it is the material which is used and which is not obtained from the animal. Whereas soft gelatin, hard gelatin, they will be having the animal origin. As far as the sizes of the capsules are concerned, these will ranges between 000, 00, 2, 3, 4, 5. So 000 to 5, that is the size for the capsule. 000, that will represent the capsule size with the largest capacity, whereas 5, that is the capsule size with the smallest capacity. So you can see the types of material or the capacity, that is the mass and its volume. So as we will move from left to right from 5 to the 000, the mass that will goes on increasing at the same time the volume that will goes on increasing. So the smallest capacity size of capsule, that is the size 5, it will accommodate the volume of 0.13 and the mass that will be 100 milligram. Whereas the largest size capacity, that is the 000, it can accommodate 1110 milligram. So that is more than that of the 1 gram of material, that is mass, and the volume will be 1.36 ml. What will be the advantages for the capsules? Now the capsules that will be having the advantages both over on to that of the solid dosage form as well as over on to that of the liquid dosage form. Now if we compare with that of the solid dosage form, what will be the advantages? The first advantage, that is the higher rate of dissolution, as disintegration is only limited to solubilization of the shell. So over on to that of the solid dosage form, let us again compare with that of the tablet. In case of tablet, the tablet has to undergo disintegration where the larger granules, they has to break up into the smaller granule, then it has to go into the solution. But in case of capsule, only the shell has to be disintegrated. So that's why it is the advantageous point over on to that of the solid dosage form. In case of solid dosage form, it is difficult to mask the test, but in case of capsules, we can go for masking the test in a better fashion, in a better manner than that of the tablet solid dosage form. Over on to that of the liquid dosage form, the capsules, they will offer the uniform dosing. Uniform dosing in the sense that the capsule is the unit dosage form. That's why whatever the drug that is loaded inside of the capsule, that can be exactly delivered, that can be exactly administered. The same may not be there in case of the liquid dosage form because of the difficulty or inaccuracy in case of measurement of the dosing with the help of the metering devices. Better stability, as the content, they will not directly come in contact with that of the air, moisture and temperature, sunlight. So there will be a better protection, so there will be a better stability compared to that of the liquid dosage form. Modified release, that is possible in case of the capsule, that is not possible in case of the liquid dosage form. So we can go for modifying the shell and its properties so that the drug release, that can be modified, or we can prolong the release of the content from that of the capsule by giving the proper coatings. Other advantages, like say the easy to swallow because of its shape, because of its elongated shape, so it is easily swallowed and it will passes through the esophageal tube. Protection of the medicament, already I explained to you. Therapeutically inert and easy to digest. The gelatin as such, it don't have its own effect, its own pharmacological or therapeutic activity. So that's why these are inert and these are as from the biological source. They will get easily digested by the biological system. These are easy to handle and carry. easy to handle and carry in terms in sense that the number of ingredients that are less compared to that of the tablet, so definitely the weight that will be less. Different sizes are available, yes, based on the choice, based on the dose of a particular ingredient or active pharmaceutical ingredient. One can go for selection of a size of capsules from a wide range of available sizes from 5 to that of the 000. The product identification that could be possible because of the capsule shell, so that we can give distinct colorings to that of the capsule shell. That will be easy to identify the product. At the same time, we can go for printing onto the capsule shell, like say the name of the brand, the name of manufacturer, dose strength, and other requirement, like say the logos, monograms, holograms, that can be imprinted. No need of complicated machinery, right? Because in case of the tablet manufacturing, we require the n number of machinery, like say from mixing, granulation, then fertile bed, then dryer, then compression machinery, etc., etc. So that much number of machineries are not required in case of production of the capsules. Filling of incompatible substances in the same, that is possible with the help of the capsules, with the help of loading a capsule inside of the capsule. The two incompatible substances that can be given. Disadvantages: the stability is low as the material for shell, that gelatin, is very hygroscopic as it is from the biological origin, so it will be subjected to that of the microbial attack. So hygroscopicity, that is the property which will absorb the moisture and will get liquefies. Cannot be given to the unconscious patients because it is difficult to swallow in case of the unconscious patient. Highly soluble salts like say the iodides, bromides, and the chlorides, they generally should not be dispensed in the hard gelatin capsules. Their rapid release may cause gastric irritation. So the drugs, the compounds which will causes gastric irritation, that cannot be supplied, that cannot be given through the this capsule dosage form. Rate of production is lower as compared to the tablet, isn't it? Because the tablet that will be having several thousands to lakhs of number of tablet that can be produced through a single hour, through an hour, but that may not be possible as far as the capsules are concerned because of the filling operations, which will be time consuming. And then again, there is a locking of the cap over onto that of the body. So all that will take the time. And because of that, it is costlier one. But as the producibility is high in case of the tablets, so that's why the tablets are the cheaper one. So all these are the advantages. The efflorescent substances that may cause the capsules to soft. These substances, they cannot be supplied. Deliquescent material that may dry to the capsule shell too excessive. Because these substances, they will draw water from that of the capsule shell, and thus they will make the capsule dry and fragile. So this particular picture that will explains the overall process of the capsule shell production. Now the process that will begins with the pins, as you can see that these are the pins, right? So the pin that will be containing the semi-spherical shape, these are the steel, and these pins are going to be mounted, right? Then these pins, they will be dipped, that is the mold pin cleaning lubrication with mold release aid. So the molded material that will going to be released. So the fresh pin, these are going to be dipped and it will passes through the different steps, like say dipping, spinning, drying, stripping, cutting, joining, right? And then getting the capsule. So the whole process that will pass is through the dipping that is nothing but the dipping of the molds into that of the solution of the gelatin. Then there is a spinning. The spinning that will ensure the uniform spreading of the gel material over onto that of the steel pins. The pins that can be rotated and then they will be subjected to the process of drying. The pins they will going to be passed at the top from the drying chamber with the controlled humidity and the temperature. Once the pins they will get dried, the pins that will getting stripped off. So once the pins or the capsule that is going to be stripped off from the pins, then it will subjected to that of the process of cutting. So there are different pins. The pins with the slight larger diameter that will be responsible for producing the caps. The pins with the slight smaller diameter that is responsible for producing the bodies. And then there is a joining of the caps to that of the body. Here you can see there is a cap, there is a body. The cap is going to be fitted over onto that of the body and the capsule is going to be produced. So this is what is the overall process by which the capsules are going to be produced. So it will consist of the six different stages, that is the dipping, spinning, drying, stripping, cutting, joining, right? You have to summarize all these processes with this diagrammatic representation. Now, how these capsule shells these are going to be produced? In order to produce the capsule shell, what we require is the material, that is the capsule material. Now, the material which is used for the capsule, that is the gelatin. Now, gelatin that is very commonly used and it is quite acceptable with the excellent performance. Another material which is used in order to produce the capsule shell, that is the hypromellose. So hypromellose that is the less hygroscopic and that is suitable for the vegetarian patients because this is from the animal origin. So those will be having the ethical issues associated with the or those who are purely vegetarian. For them, the hypromellose capsules are the supplementary or the substitute which is available, and this does not have any kind of the stability issues. So these are the advantages over onto that of the gelatin.